This is the works that I do for whole days and summarize all the nutrient that you are needed for pregnancy. So basically, the important things that your doctor always told you that before you're pregnant, you already need to consume the folic acid lah. So basically, folic acid is the B vitamin So the requirement is around 400 to 800 mcg. Okay, if you have your own supplements and then you need to notice that you need to consume for 400 to 800 mcg. So our body really need it to make the new cells. During early development, folic acid help form the neural tube. Folic acid is very important because it can be prevent some major birth defect of the baby brain and the spin. And this is the double X already consists of the folic acid. Okay, one tablet got 300 mcg, and daily life we need to have 400 to 800, right, for the pregnancy. So we need to take the 2 tablets. And the suggestion of the Nutrilite double X also 2 tablets. So it's enough for the pregnancy. So for the calcium, is it the calcium double X contain the calcium, but the requirements for our pregnancies is higher, much more higher than the double X too. So we need to take another calcium magnesium in order to just take the double X only. So actually calcium is very important for our parents, for mom and also the baby. So baby can be a bone and teeth for sure for calcium, boost the muscle, heart and nerve developments as well. So calcium is a high requirements. Also here I take double X 2 tablet in the mineral day, multi-mineral day already contains around 115 mg, but we need 1000 mg. So basically I take 3 tablets of the calcium D plus and 2 double X minerals, multi-mineral, then should be enough for 1000 Okay, but actually if you consume more than that also don't worry because it will be a soluble it will be disgusted based on your urine, so you don't worry. But if you are just take the double X2 and you didn't take the calcium magnesium, suppose you only have 200 plus mg only, it's much more not enough because the vitamin D can help us to absorb the calcium. So we need to take the calcium magnesium D plus for 3, and then the double X is 2. If you think that you already consume a lot of the meal and those things, you can be reduce the dose to calcium magnesium 2. Like me, I take calcium magnesium D plus 2, sometimes 2 and sometimes 3 and double X 2, and my report is very good. So for this one is the iodine. Iodine is very needed, essential for the healthy brain development in the fetus and young child. And basically iodine, this one is found from the seafood but basically if you're pregnant, a lot of the people seek for the seafood. So it's good that you take the supplements and the seafood also quite expensive. So the dose needed actually double X, you take the 2 tablets to be enough I think 60 mcg. Okay, requirements is 150 mcg to 290 mcg. So I just take 2 tablets of the double X. So suppose I got 120 mcg. So actually if because and when nutrilite is good, sometimes we contain it and it also help us to absorb the mineral. So I think that 120 mcg okay already lah, huh? For sure we still got eat other things, other food to make sure that we have more iodine. For the irons, iron you need this for to make the extra blood for your baby. Your baby use iron to make extra blood for you and your baby during pregnancy. Iron also help move oxygen from your lungs to the rest of your body and to your baby. Okay, getting enough iron can prevent a condition of too few red blood cells that can make you feel tired, called iron deficiency anemia. So basically, for the iron, double X also contain the irons. Okay, the requirements is roughly 20. No, sorry. Double X don't have iron. So you need to buy iron folics for your to support your pregnancy time during your pregnancy time. The doctor say iron is very important. Iron folics is a 10 mg per tablet lah if you take this one. So you can see the photo here. I put it here. So you need to take 2 tablets in order to for your supply your things. And this B12 already contained in your double X, so you no need to worry. Also 2 tablets are enough lah. So vitamin B12 is very important because it help keep the body nerve and the blood cell healthy and help make the DNA, the genetics material in all cells. A deficiency is associated with increased risk for several adverse pregnancy outcome for both mom and fetus. So B12 is very important as well. And we have a double X with the 6 mcg much more than the requirements. And the vitamin B3 in pregnancy niacin is very important. It can convert to the NDA, which is necessary for metabolism, fat, carbohydrate, protein, and alcohol in the body to give us energy. Vitamin B3 is also necessary for DNA repair, cell signaling, and synthesis of the fatty acid. So actually DNA is good for our brain as well and our baby brain. So hope that our kids brain is very clever. If you are not clever enough for sure this is also influenced by your genetic. If you are clever, should be your kid also not much problems. But if you for sure we want it more than that So important of the vitamin B3 in the pregnancy actually can be prevent the birth defect. So basically all the vitamins is quite important to make sure our babies all have a well development. So essential for development of the baby brains, prevent miscarriage, give us energy, keep skin and other organs healthy, reduce the nausea, and improve the digestion, reduce the migraines. For the vitamin B6 helps your baby metabolize protein, fats, and carbohydrate. I also consume nutrilite protein as well. So it also helps form new red blood cell, antibody, and the neurotransmitter. Along with assisting in the development of your baby brain and nervous system, vitamin B6 can ease pregnancy-related nausea and vomiting. So before, I think the month, second month, third month, and fourth month, some of you will be maybe sick of the baby sickness. So morning sickness, so you need to consume B6 to help you release the sickness of that. So B6 in double X also at least you need to take consume 1.9 mg but double X already have 2 mg for vitamin B6 it's much more quite more and enough for you to already. So for the vitamin C, because I consume a lot of the fruit, so I didn't take extra bio C. I just take the double X. Both, even though the vitamin C really high requirements for vitamin C, but you also can add in the bio C as well. Both you and your baby need vitamin C daily because it's necessary for the baby to make collagens, a structural protein that are component of the cartilage, tendons, bone, and skin. Some researchers believe that vitamin C deficiency in newborn baby can impair mental development as well. Also known as ascorbic acid, vitamin C is essential for tissue repair, wound healing, bone growth and repair, and healthy skin. Also known as known as ascorbic acid. Vitamin C is essential for the tissue repair, wound healing, bone growth, and repair, and healthy skin. Vitamin C helps your body fight infections and act as an antioxidant, protecting cells from damage. So vitamin C also can help your body absorb the iron as well, especially from the vegetarian source. The requirements for the vitamin C is 85 mg, but the maximum is 2000 mg for age 19, and then if the age 14 to 18 should be just consume 1800 mg enough. So double X multivitamin 60 mg for vitamin C per tablet. So actually it's a much more less little vitamin C only, so you can be add on the bio C. So vitamin E helps your body create and maintain red blood cells, healthy skin and eye, and strengthens your natural immune system. With its antioxidant properties, one of the vitamin E main function is protecting cell membrane from damage. A healthy intake of vitamin E contributes to the structure of cells throughout your body. So for the vitamin E, I search for it. It needs a 22.4 IU, and then double X got 15 IU per tablet. So I think it's enough already for vitamin E. And the zinc benefits for the pregnant woman. Zinc will help maintain a strong immune system, avert intrauterine infection, help balance the hormones at the productions of the placenta, boost cells growth, boost DNA production and functioning. This one is a zinc benefit for developing your baby. Just now is for you as a mom. Boost DNA productions and functioning, provides structural support to the protein that make up the cells. So for the zinc, I check it double X only 7.5 mg per tablet, and the requirement only 11 mg, so it's much more enough for zinc. If you just consume the double X, that's enough. So for the DHA, you need to take another salmon omega complex. So this one I take one only, even though some of the researchers say we need more than that, but I didn't take much, I just take one. So DHA build healthy tissue in many organs throughout fetal developments and after birth. A developing fetus rapidly accumulates DHA in the third trimester. DHA during pregnancy improve birth and infant outcome, help your baby brain's development. So the requirement actually is 800 mg, but salmon omega complex only 120 mg. But I follow the instructions. I just take one. Please subscribe my channel to support my contribution. I do this live for whole day. Thank you your support. Bye. See you next time.